Okay. All right, I'll go ahead and just jump right in, and we'll add people as we go. So welcome to our February CI Mastermind Live. Most of you have seen this. Most of you have seen kind of my intros before, so maybe I'll keep this a little shorter today. I'll just kind of say Mike Englehardt is here. He's going to walk us through this concept of lean benefits. And I'll say a couple things more before I introduce him and his topic. You guys know this, what we're all about. Manish, thank you for joining us. But we do this every month, and it's always a different topic. And we're always looking to solve some real problems. So this is certainly a real problem. And I always just ask everyone to respect each other on the call, as well as don't share anything that that might be specific to your company that shouldn't be shared. Okay. Last month, I discussed leader standard work. And I also discussed, I think, that we have a leader standard work program at Chalmers Street. I mentioned that it was this group that helped me kind of design and launch that leader standard work. So I just wanted to spend a couple minutes here telling you what that's about. So currently we have 4 clients running leader standard work. 3 are fully deployed. 1 is, I would call them in a monitoring and maturing phase. Kind of like I talked about last time. You know, leaders often aren't given the structure they need to know how to manage their day, and so they get pulled. And we talk a lot about that with our clients. It's like, is your day pulling you, or are you organizing and executing on your day? And of course, too often it's the other way around. So this is to help that, like to help the accountability. It's to help making sure the right priorities are getting done. We were just talking with a client this morning about they have a new CI manager. She's doing great, but she wants to take on the world because she's just that personality, and she's going to end up spreading herself too thin. So we're using leader standard work to help prioritize and organize what she's going to do. When we deploy leader standard work, we always say there's 2 key components: an artifact and a process. And I see deployments where there's a lot of emphasis put on the artifact, right? Because that's the form that we're collecting, and we're putting our checks in to say, here's what we're doing, and capturing metrics and all that kind of stuff. It's important. It's a record that we use in our process, but ultimately what we teach our clients is that it's really the process that you have to get right. The conversation of what should be on my leader standard work, getting that right. The discussion of what we missed, what we didn't get to, and why, getting that right. It's the process that's so crucial to roll out a leader standard work program. So that's where we focus our effort. We train groups, we set up templates, again, the artifact, right? And then we use a process with a dashboard and a cadence, a feedback cadence, to ingrain that concept of, okay, I should have a very routine day, a set of routines I do every day. There's certain things I should capture along my day. And when something doesn't go right, I should document that so that we can talk about it later. And so we put a lot of emphasis in this piece, the dashboard and the discussion around the dashboard. And that's just a picture of the typical leader standard work form. Ours is actually online. And then the dashboard that is part of the reviews that we have with the leaders. So it's a great program. Looking for more clients on it. If this is meaningful to you, or if you know of someone that it would be meaningful to, I appreciate talking with me after the call and sharing where you think we might be able to deploy more leader standard work. Any thoughts or questions? All right, excellent. Okay, one more thing before we get to Mike. So next month, we're going to talk about de-risking your automation deployments. In some way, shape, or form, all of our companies are trying to automate something. Physical tasks, electronic tasks, we're all trying to automate it. And what I really want to, James has been on a couple times now, so some of you may have already met James on previous calls. And, I think last time, the last times we've been kind of more future oriented, and not that this won't be future oriented, but what I really want to hammer on and what James really wants to talk about is this right here. Too often managers get excited about new technologies only to find they are automating bad processes. And I suspect we've kind of seen this, and we get the software is going to solve everything, and of course, that's not realistic. It doesn't work that way. And I can see Dylan is smiling. And so he's going to talk about that and what are some of the structures that we need to put in place so that we don't lock inefficiencies in. Automation makes you less flexible. There's no two ways about it. You become less flexible in an automated environment. So we need to pick and choose and make sure that this is a process that's going to stay around for a while before we invest in automating it. And again, we don't want to automate some piece of it that wasn't really necessary in the first place and just automate a bad process. So hopefully you will be able to join me. As always, I'll send an email afterwards so that you can sign up. So just a couple things I want to say here. So Mike and I have known each other for quite a few years now. I have felt part of the reasons why I think he and I hit it off so well is, well, broadly, I think in our great, wonderful country, we do a very mediocre job of education, and we do a great job, but expensive, overly expensive job at healthcare. And we'll see if Mike agrees with even the great. But the point is that those are two areas that are absolutely important to society, and I scratch my head, how can we be doing so poorly in those two places? And so Mike's been attacking it, and I've always said, if there's a way that our skill sets, the skill sets of the folks that are on the phone here, can help in healthcare, we should be thinking about how we contribute. And so, Mike and I collaborated for a while. He's built a program called Lean Benefits. And I think it's definitely a step in the right direction. Maybe it's multiple steps in the right direction. So I asked him to come on today to talk a little bit about how he sees Lean helping the benefit space and answer some of your questions or some of your experiences that you've had with trying to maybe get benefits or improve benefits inside your company. So that's my introduction. Mike, did I miss anything? Can you just start by introducing yourself and telling the group a little bit about yourself?
Yeah. Hi. Thank you, Matt. My name is Michael Englehardt, and again, Matt and I have known each other for years. And in terms of my background, I have been not only involved in healthcare and delivering benefits to companies my whole career, 30 plus years, but I've always been that. I've always been that person to just kind of question status quo and kind of, why can't we do that? Why can't we do this? And what I didn't realize is that as I was doing that and kind of questioning status quo, it would turn into a whole process for me personally. But then now the industry is kind of, and I hate to say catching up, but you start to hear about these nonprofit groups that are out there to transform healthcare. And it's appears to be new, but I can tell you firsthand, there's nothing new about what people are doing. There might be new vendors out there and new people saying things in a different way, but Lean Benefits really, it encapsulates it But more interesting to me, at least, is because no one really understands healthcare and they don't spend enough time involved in studying healthcare. It kind of explains at a really high level what it is, and it helps a lot of people just to understand what the solution is. And that's actually something that Matt, I mean, being with Matt helped me to come up with the term lean benefits, because I was in fact trying to explain what I did and what made me different, but I was speaking to a manufacturer. And I said, well, lean, you utilize lean and Six Sigma. Yeah. You understand the benefits of it. Yeah. Like, well, I do that, but I apply those principles to healthcare. And he's like, oh, okay, I get it. How do you do that? And that's what we're going to talk about today. Kind of what all that means. Um, so I'm, go ahead, Matt.
Well, yeah. Do you want me to start with a few questions, and then maybe you can give a little more structure to what you're describing there?
I was just going to say is go ahead and please ask some questions if anyone has anything on their mind they want to get into.
So Dylan, you had kind of a broad statement, but I think it's a good way to get us started. And the question I had asked in the registration was, are there particular aspects of your health plan that your employer does not feel are controllable or manageable? And Dylan works for a healthcare insurance company. And so he wanted to, he's interested in hearing the specific challenges inside of health insurance, and through the eyes of a member and their employer eyes as a commercial group. So I don't know if anyone wants to add anything to that, or Dylan, you want to kind of say what you see in terms of challenges.
Yeah, I can add a little bit more to that. So yeah, I work for an insurance company. I have now for the last 2 years, two different companies actually, in like the same market space. So yeah, I think that's kind of the thing that everybody beckons to, is that healthcare in the United States is very complicated. Not even just on the provider side when you're going to get your care, but also taking care of your claims and how your benefits pay out, and everything involved in the journey to living a healthier life, right? So I think it can be, obviously there's different pain points with different companies, or different pain points with different market segments, people that are on Medicare versus folks that are a member of a commercial group through their employer, or folks that purchase individual insurance through a state marketplace or something like that. So I would love to just hear more from other people on what they view as challenges, because I'm sure they're not things that are like, well, I've never heard that before from somebody else. So I just want to hear kind of specifically some of those things that are impediments to other folks, because I think that would be really valuable for me personally. So.
And Dylan, do you mind if I ask, do you work for a health insurance company, a third party administrator?
I work for a health insurance company. Yep.
You do? Okay. All
Yep.
right. Good to know. Good to know.
So does anyone want to add anything that they see, like from Dylan's question, like problems they see at their firm in terms of the health insurance? I'd say, Dylan, knowing what's covered and what's not covered to me is the biggest challenge. And I've seen it both, from a personal perspective, but also we did a project with a company that provides healthcare supplies, and a large call center whose pretty much all day job was sifting through endless codes of, different supplies have, I guess, different codes, and those different codes are approved by, I believe, both the doctor and the insurance company. And man, did that create a mess. And certainly we should be most concerned about the mess that it created from the perspective of the patient on the other side, trying to order something like maybe it's home care and they're trying to get rubber gloves.
Yeah.
But even the company perspective, there's huge inefficiencies because their revenue cycle was so I don't challenged, right? Because they would have these orders in limbo. Like typically they would just ship it, right? If the person asked, they would ship it and they'd figure out the insurance on the back end. But that would mean that sometimes they had stuff out there they weren't collecting revenue for because they were still trying to resolve some coding issue. So that would be a big one that I would say I've borne witness to.
Sure.
And see, one of the things that I would say, Matt, just kind of in response to what Dylan asked, his question, kind of side note, is that I think there's a general misunderstanding amongst the employer population that insurance companies provide healthcare. You get a Blue Cross policy, United Healthcare, you insert the name of the insurance company, they're going to provide healthcare. You're buying healthcare when actually you're buying insurance coverage, but the actual healthcare is being provided by providers, the doctors, the people that you're seeing. And it's a real disconnect because if you don't, you need to understand where you're actually getting your healthcare, and that there's a aspect of quality that also is involved there. And just relying on a third party to provide you what you think is going to be equal across the board, every doctor, they're approved in network, they must all be good because they're accredited. That's where there's such a huge misunderstanding that can lead to a lot of the other inefficiencies that are present in the system. So
Mike, that would be a good one from a process streamlining. I don't know if you and I have ever talked about that one. Is there a lean benefits solution to that problem?
yes. Yeah. So if it's all right, I could show you a slide that I have kind of breaking down, one of the things as I pull this up, that just for the amount that I've hung out with Matt. Oh, wait a minute. That I've hung out with Matt is I know a portion of what Matt does is sit with employers and understand where there are opportunities to improve efficiency, eliminate waste. Would you say that's accurate, Matt?
That better be accurate.
So the challenge, it actually is a challenge to me, is that almost every employer knows that there's a ton of waste in healthcare. Inherently, everyone knows who's ever been on a health insurance plan. Now, it may be for a number of different reasons, but everyone knows it costs too much. There's a ton of inefficiency, and you hear all over the news that this knee replacement cost $100,000 in one hospital and $20,000 in another hospital. But still, employers make the same decisions over and over and over again. They know that the problem exists, but they don't take action to fix it. This particular slide, it really just highlights where some of these areas of waste are. Misdiagnosis of treatment. We have the Mayo Clinic saying that 88% of diagnoses that they perform in terms of second opinions lead to a change in the initial diagnosis. You stop and think about that. 88% of the time someone asks for a second opinion, what they were first told was the diagnosis has changed. So I can't emphasize enough that seeing the right person the first time that has the knowledge to be able to diagnose a particular condition is beyond critical, to the point that that alone can account for 10% of what our total spend is. When
How
we
do I
look
know if
at
I'm dealing with the right person?
so that was kind of what I was alluding to, Matt. But then when you look at the next statistic, 30% of all surgeries are unnecessary. It kind of is a byproduct of people getting one opinion saying that is my doctor, or it's the doctor that my general practitioner recommended I go see and said they're quote unquote good. I'm just going to stick with them. Well, that's leading to unnecessary surgeries, unnecessary imaging. People focus on the discounts they get in their insurance, with their network. Blue Cross has the biggest discounts. The best type of the best type of discount is one for a service that was never incurred. So then you can look at close to 20% of claims are processed inefficiently or incorrectly. So we're paying an insurance company or a third-party administrator to pay claims, yet close to 20% of the time, for a multitude of reasons. Okay, I'm not saying that insurance companies or third-party administrators, there's multiple reasons for these errors, but when these errors are taking place, there's a heightened scrutiny that needs to be placed on it, not just from the insurance company side, but also from the member side. It's simple things like reviewing bills and things like that.
Well, and it's that's the complexity that I was sharing earlier, that's kind of built into the system. As we try to get it to do more things, it's not really designed to do them.
Correct. It's built the systems are built on such a number of legacy platforms that have been bolted on with these new solutions. It's impossible. And there was a study just that came out, and I don't have the details. It's literally impossible for a major insurance company to just change the platform that they have in place today. It's impossible for them to just become more efficient and adopt a new system. But the biggest one, and this is probably the one that's in the news the most, prescription drugs. I think we've all heard of Mark Cuban and what he's doing in the marketplace. And that is one example of probably, a couple dozen different solutions. And I don't mean vendors, solutions that are available in the marketplace that are alternatives to purchasing your medications through the traditional PBM or pharmacy benefit manager. Okay. And one of the reasons, and I think misaligned incentives is a major reason buyers don't stop to think about, is as an employer, if you buy, and I'll pick on Blue Cross again, Blue Cross self-insures that plan for you. You not only buy the Blue Cross network, but you also get Prime Therapeutics along with it. Prime Therapeutics is a partner. There's some ownership there. They're definitely aligned. Okay. And I bring this up because there's a revenue source, there's a profit center with Prime Therapeutics on the PBM side, but it's Blue Cross that is having employers sign off on contracts. And it's Blue Cross that's also getting a revenue source from the prescription drugs. So it's like we have one party with other interests, financial interests, putting together contracts for our employers, and our employers don't have the knowledge base to understand what these contracts say. And they're signing off, and in some cases, taking away their ability to take advantage of programs that are available in the marketplace. And I can go into a couple of those in a bit, but all in all, there is literally, and when I say this, it's I've seen this firsthand with my clients. There is 40, 35 to 50% in what an employer pays today is at stake. Now, I'm not suggesting that every employer should go out there and just make all the changes that it would take to reduce their cost by 50%. But what I can say is that there is so much waste inherently in the system, inefficiencies inherently in the system. The opportunity to make change at a 10 or a 20% amount is definitely reasonable. And to be a little bit more clear, as I know Matt does with his clients, he identifies places to create change, positive change, improve efficiencies. In healthcare, it's these main four: pharmacy, your high risk patients, your high cost patients. That's another category. Primary care, and I'll talk about that in a second. And then there's value-based purchasing. And the reason these four buckets exist, and it's the place that any employer can look or examine their own plan, is because at a high level, I just spoke to pharmacy spend. Okay, I use Blue Cross as an example. That's an opportunity with any PBM out there, and there's a multitude of pharmacy programs that are traditional or pass through, or all this lingo. But between having the right cost of medication and utilizing the programs available in the marketplace, there is 8 to 12% that is available. I'd say closer to 5 to 7% of an employer's total spend that could be reduced by maximizing the programs that are available to them, being aware of them and then maximizing them.
So there is lingo here, and I think there's a couple important points to make. But one, a PBM is
a pharmacy benefit manager.
Got it.
So I apologize. So when you get your prescriptions at the pharmacy, you're utilizing a pharmacy benefit manager.
And one of the things that Mike's bringing light to is this is a system that has to be studied like any operational system, like an operational system in a hospital, in a manufacturing setting. It has to be studied the same way. And the like he's showing here, right? The major costs of, in this case, causes of cost drivers has to get pulled out. And so I would say that's the first step in lean benefits is being able to show clarity in kind of top level causes, because there's root causes below each one of these things that Mike has up here. So Mike, I think continue on a little bit. I want to make sure I give some time to other questions, but I think this is good. Yep. Continue on, please. Yeah, sorry.
For sure. And the one thing I want to take a step back and say that before you get to a point of, yes, I may inherently know where to look to create change in an organization. The key is data. And I think that's inherent in any topic or discussion. But when you have the data, it can identify where there are opportunities.
Well, that's why I wanted to hit on that point. How do you know the physician you're going to is the one that will diagnose correctly? And I've seen this in an issue in my own family where it occurred, exactly what you're describing. But how would that person have known who they should go to get the diagnosis? And I think there's a lack of data in the system for us to better manage it.
Yeah. And Matt, what I would say is, in general, you are correct. There are some insurance companies that are trying to make that information more available, but everyone on the call here has to understand that insurance companies contract with health systems, not providers individually anymore. So what happens is, when say Blue Cross, when Advocate contracts with United Healthcare to be a part of their network, Advocate says, you're going to take all of our doctors, not just the ones you want. Okay. So there are some restrictions put on insurance companies to be too detailed in regards to which doctors have the better outcomes than others. There's some restrictions put on employers, and that means that an employer needs to really go to the market and understand or identify, a third party service that can give them that information so they can get it to their employees. That's what I do with my customers. So Matt, it's a good question. It'll be a while before insurance companies can get too precise in regards to which doctors are say the best at knee replacements versus others. Whereas there are plenty of other vendors that are out there that have that data build. I'd like to. Are there any other? I have talked a lot, and as Matt pointed out, I get into some of the specifics, and I want to back up and just see, is there any general, like I'm curious when you asked the questions you did to your other colleague back at your company, what were the general comments you heard back from them in regards to either challenges that you're having with healthcare or pain points or anything like that? I think I heard. Oh, go ahead.
Yeah, go ahead. Did somebody
I
want
was
to
gonna
add?
say I heard one person, one response. I read one response. Well, costs are too high. Costs are too much, which is kind of, I hear that.
I think that was from Jason. Jason, could you expand on that a little bit?
Well, some of it might be like organization driven. So I've been in the healthcare industry for the past 5 years now. So the first couple of years I was at a very massive system. There's almost like 100,000 employees. So, my benefits cost me X amount per month for medical and dental for basics. Now in a different system that's a bit smaller, not tiny, but my monthly premiums are probably 4 or 5 times the amount that I paid at the bigger system for basically the same damn thing.
And Jason,
So
if
don't get me started.
Jason, thank you for your comment, because it brings to light something that I don't think is talked about enough. It's where I think our health system kind of went off the rails years and years ago. It used to be where you had a hospital deductible, and when you got put in the hospital, you had a small deductible, say $250 or something. Then you paid some percentage after that, and you had the same thing for physician, small physician deductible, and then after you met that small deductible, then you paid a percentage after that. It was very simple. What complicated things and diluted things and kind of changed how people buy healthcare was when these copays started to be introduced. It's $25 to see your doctor. It's $50 to see your doctor. It's $5 for a prescription drug. Now it's 10. Now it's 20. Now there's a copay for the emergency room, and based on the company you go to, it's more and more and more. And then as costs continue to go up, well, we have to charge our employees a little bit. We have to charge them a little bit more. Healthcare costs are going up. And if you look at a graph for the last 20 years, the cost share percentage that employers have pretty much maintained is about 72 to 74%. that they pay of the bill, which means the percentage employees are paying is about the same, but the total bill has gone up about 4 times over the same period of time. Okay. So costs have gone up, but the members, the people using the system have lost touch with the cost of the procedures they're having done.
Can I make
it gets to what Jason said is my costs coming out of my paycheck are astronomically more, and I'm not getting any more value for my dollar. And that's a basic summary of what is going on with healthcare.
Yeah, I mean, basically, like, I'm a healthy 52-year-old. I've literally been to the doctor once in the past 20 years. I've been in the hospital once in the past 20 years. I've only been sick literally like once in the past 20 years. My insurance is basically just to make sure I'm covered in case anything catastrophic happens. And it's still, significantly higher than previously.
And I know Mike has something to say here, but and by the way, your employer looks at their side of what they're paying for your health insurance as your wage increases, right? Like the amount, the percentage of increase that you get is less because some of that is going to those increases that Mike was talking about in healthcare. So it's insidious because it's hidden. It's not visible to us in a way that we can, again, that we can understand the data and fix the problem.
So, Matt, I want to ask a question to the group, and it's an interesting one that you can ask back to the person who really runs your healthcare plan or the CEO or someone like that. Is if there were 10%, if you could reduce the costs for healthcare by 10% or more, 10 to 20%, would we take that money with that savings? Would we invest it in the company, either improve our company valuation or keep it to have a better financial year? Or would we invest it in our employees? Would we try to reduce their costs, improve the benefits? Because nowadays, one of the biggest challenges is retaining key employees and attracting new employees. How do you do that without having to come up with additional dollars to do it? And I think the answer to that question will tell you, hey, maybe an employer doesn't have a need to be financially, to improve financially, and they don't care about their employees. Chances are that's not the case. But the answer to that question will give you some light as to the type of employer that you work for, whether that is of value to them at all. Because if addressing these things isn't of value, or the results that it could drive in other parts of the company aren't of value, then it's just not a discussion to pursue, which is really what I follow or what I have found in my years doing this.
So Mike, do you have a question for the group that you want them to answer?
That it's that question. It's the people that you went back to initially to ask the questions regarding your healthcare plan. Go back and say, if we could reduce our healthcare costs by 10 or 20%, what would we do with that savings? Would you put it into other things for the people and invest in our personnel, either to reduce their cost share on a monthly basis or improve benefits? Or would that really just go towards the financials of the company and having a better year? That, to me, and I would think to you, it's a key question. Maybe there are other initiatives you've identified that require some investment. Maybe those dollars could be used for that investment to do something that may be more game changing than improving benefits for employees. I mean, it's kind of a means to an end, but getting an answer to that question could be valuable. Sorry.
And just to add, I think the challenge in the times that I've engaged with Mike is getting CEOs to care about this. And it's not that they don't care about providing their employees benefits. It's that and this is I've seen some of Mike's slide decks. They can be quite long, and that's not a Mike, that's not a shot at you. It's that it's complex because it gets right down into contracting and how, certain benefits are, how the delivery or the availability of those benefits are worded. And I think for a lot of leaders, it's an area that they just want to press the easy button, which is kind of why we're getting what we have. And maybe this, Emily, you have a question here, that it's maybe tangential, but it's at least along the same lines. You said, as an overarching concern, our organization has a lot of benefits it offers, but only one dedicated benefit administrator on staff. This centralizes all the benefits knowledge, right? Which we're just talking about is so complicated, by the way, down to a very few select people, which makes it hard to resolve the benefit inquiries that come up, especially at times of enrollment. Is there anything you want to add to that, Emily?
I mean, it's pretty self-explanatory. We have one person who takes on all of those questions, and then it's a huge bottleneck, right? Because, like I said, enrollment time, there's a ton of questions, and so we sit here and we're like, well, they'll get to us eventually. And I mean, they're only doing what they can do, right? There's only so much that they can do. But even when they don't have an answer, then who do we go to? And a lot of us just get lost because that's the person we're told we can go to. And then we have to answer our own questions and we just get more confused. So, yeah.
Emily, I really appreciate that. And it's the reality of most organizations, many organizations, I should say. And it kind of gets to a comment I had made earlier, which is, most people that manage a benefits plan don't have time to dig into all the detail here that I'm talking about. It really comes down to your benefits person and a CEO. They just want someone that they can trust and they know understands all this and make sure that they're doing the stuff that they need to do. It doesn't give them all these details because they don't have time for it.
Mm-hmm.
And so so what you're going through, it's very commonplace, and it's the thing. It's actually, I'll tell you about a series I'm having. I'm trying to help organizations solve that problem. And I'll tell you a story, and it's kind of why I do all this. 20 some years ago, I worked for a company, a broker in Wisconsin, and their client was a company called Serigraph. And some of you may have heard of the book, The Company That Solved Healthcare. That the CEO of Serigraph wrote that book. And the reason that he did was because he had come to us. We handled their benefits. He had trended out his healthcare costs 10 years and said, it's going to bankrupt our company. They were a manufacturer of like 1,000 employees. He's like, we have to do something. So we sat down with them, and this was not my client, but we sat down with them and went through a number of different solutions and implemented it. And Matt, when you're asking about quality, we implemented a quality solution so employees could identify quality, and we actually reimbursed employees for doing that. I mean, we gave them they saved like 40% in their healthcare costs, saved the company. That's why he wrote the book. But then he also started something called Serigraph University. He wanted to teach area employers exactly the blueprint of how he did it so they could do it. And I always thought it was a genius idea. There were tons of employers that just participated and learned. And the only thing that I didn't agree with was he charged a boatload to employers to attend. And it wasn't easy. It was like 3 full days in person that no one has time for because it's a office of one. So that is the thing that's really kind of driven me throughout my career. And I am just starting something called the Lean Benefit Series. It's 3 easily digestible webinars it's led by experts to explain all the detail. But it gets the consultant out of the middle giving the advice. So they'll be able to come in 3 sessions, hear about all the things they should be aware of, but then we're going to have a half-day session, and everyone will bring in their data, their claims, and all the things that are cost drivers, and they'll leave with a blueprint. Here are all the things they can do, and kind of a plan for renewal. So it'll hopefully alleviate the questions they have. They should get up to speed in terms of what's going on with healthcare and all that. So that's kind of my effort in solving that problem, Emily.
Awesome. Well, we are actually a little over time. Mike, thank you so much. I think let's make sure, I know you have a registration link for that series that you're doing. So maybe, right? You do, don't you? Like some kind of registration?
I do.
Okay.
I have a registration link and landing page, and
yeah, send that to me and I'll include it in my after session email. And if anybody wants to join that, they can register for that. I'll just close by saying, there's untapped efficiency gains in this area. It's not a place that we typically look at as continuous improvement professionals, but it is a huge and somewhat hidden cost inside of all of our companies. And when we're trying to find money for investment, like Mike's saying, it's in there. And not to mention, it's just a societal good, right? I mean, gosh, for that reason alone, we should be talking more about this. So, Mike, I appreciate you coming on. I appreciate everyone joining. It's a little bit different topic for us, but I thought we had a good conversation. And I look forward to seeing everyone next month.
Awesome. Thanks, guys.
Thank you.
Thanks, Matt.
Thank you.